Hello, everybody from Barcelona. Hello. In the name of the ZAGA Centers Network, I'm very much pleased to welcome you to this Zygo webinar. First of all, I would like to thank all the colleagues and friends seated on the other side of the screen. I would have preferred to have you in a more physical manner, but I had to recognize that a greater number of participants is achieved by using a home chair instead of a theater one. As you may know, this webinar has its origin in substitution for the first ZAGA Centers annual encounter. The meeting was scheduled to happen in Padua, Italy, very nice town in Italy. Dr. Olivo was in charge of this meeting actually, but the current situation made us to modify its form. Now, before starting, I would like to point out some aspects of our mission at the ZAGA network. The universally accepted indication for zygomatic implants is known as a zygoma quad, which is the installation of 4 zygomatic implants with a nice AP distribution. This indication comes in a very tragic moment for the patient's life, and that is the moment when there is no more bone. The moment where that patient is condemned to the use of dental adhesive to retain a removable denture. The moment when social life disappears and frequently depression appears. I think we should face that responsibility, considering that there will be just a single opportunity to rehabilitate that patient. Single opportunity. Zygomatic related complications exist. Moreover, they are very difficult, if not impossible, to treat. Complications should be foreseen and prevented. Otherwise, patient may be knocking on your door for the rest of your professional life. Professional life. Isaac Newton said, "If I have seen further, is by standing on the shoulders of giants." In the same manner, I am very pleased to thank the giants that have helped me to see further. First of all, I thank all the lecturers that have accepted to be here with us. I would like also to recognize the confidence of the ZAGA centers, especially the first ones. The first ones in raising their hands when this current reality was just a project. Special thanks are given also to Mr. Graham Blackburn, CEO at Southern Implants, for his enthusiasm and help on the new ZAGA implant design.
No, don't worry.
Also, I wish to thank the Straumann team for their faith and implication on the Straumann ZAGA zygomatic implant new portfolio. I cannot finish this without recognizing the silent but so important task of the ZAGA Centers team. Mr. Radu Trasko, social media technical director. Mr. Jaume Villanueva, PhD, our critical reviewer on entrepreneurial aspects, also necessary. And our CEO, David Pastorino, engineer and PhD on bone regeneration. Thank you all. Thanks. Now this is the real moment, the moment to introduce Dr. Michael Pickers, ZAGA Center Tampa Bay, which is the chairman of this event. Dr. Pickers does not need really an introduction. Michael is about a person to imitate, a true charismatic human being, hard worker, humble and generous. He is conducting a marvelous educational implant program in Orlando. Just look for the PICOS Institute and you will be aware of the quality of the courses there. This includes topics as implant and soft tissue grafting, alveolar ridge strategies, sinus grafting, guided full arch, and the famous PICOS Symposium. Thanks, Michael, for having accepted to chair this memorable webinar. So please now, Dr. Picos, take now the lead of this ZAGA meeting. Thank you.
Well, thank you so much, Dr. Aparicio. I can't tell you how honored and humbled I am to be part of this wonderful event. In fact, I would like to personally welcome all of you to this ZAGA Center's digital meeting 2020 on zygomatic implants. And again, I am truly humbled and honored to serve as your moderator for this unprecedented global event. In fact, this is the first digital gathering of this group. And as Dr. Aparicio mentioned, unfortunately, we could not be in Italy as planned with Dr. Olivo. However, I'm certain that in the near future, we will be able to once again be amongst each other in person. And of course, that would be so much more effective. But that said, this virtual set of presentations will be, I feel, equally as effective for a number of reasons. Our topic, by the way, for this first digital gathering is the clinical case from which I learned the most. Now, before I go on with the actual program and more or less give you a good outline of what we're in store for, those of you that aren't really familiar with the ZAGA Center, Dr. Aparicio really is so humble himself that I would just want to take the liberty to explain a little bit better what he has done for all of us. Because these centers are basically places where patients with complex maxillofacial atrophy can come and undergo much needed fixed treatment using the latest, and I mean the absolute latest, zygomatic dental implants. All centers are dedicated, globally mind you, to enhancing the success rates of this treatment, reducing complications, and providing each and every patient with optimal care. And for the very complex cases, our very highly skilled international partners will collaborate to ensure that the best possible treatment outcomes will result for our patients long term. And this may mean a number of things like designing quality instruments, materials, and even implants to suit the requirements of each clinical case. Inevitably, along with the highest standards of clinical excellence, the ZAGA centers are internationally renowned as places of quality, integrity, and above all, trust. So with that said, it gives me great pleasure to introduce our master clinicians who will serve as panelists and will share their respective experiences within the realm of zygomatic implantology. These distinguished clinicians include Professor Chantal Malavez, Dr. Costa Nicolopoulos, Professor James Chow, Dr. Human Zarenkelk, Dr. Ruben Davot, Dr. Antonio Olivo, Dr. Leslie David, and last but not least, Dr. Carlos Aparicio.